Hi there, David Fitzgerald here from Dublin Physiotherapy. Today I'd like to share some information with you about braces and supports. Um, Not all braces and supports are created equally. They come in different shapes and sizes, literally, and have a different function depending on the type of support that's chosen. First thing I would say is that the general principle is that if you can do activities and the things that you want to do without requiring some support, that's obviously the ideal. In clinic, we tend to see patients who may have had long-standing problems or have had significant trauma, and sometimes it's not possible to fully rehabilitate an area to withstand the kinds of stresses that they may want to do, whether it's kicking football or going for runs or hill walking or whatever their chosen activity may be. So in those situations, you have to consider whether a brace will be an appropriate thing to use. Now, usually one of the first objections to any bracing is that, people will say, well, will my muscles weaken because I'm using a support brace? And as far as I'm aware, there's no evidence to indicate that that is the case. But from a pragmatic point of view, my perspective is that if a brace allows you to do a much higher level of function than you would be able to do without it, then you would be getting massively more muscle activity than you would if you didn't do the activity. So if the brace facilitates that, from my perspective, that's a good thing, and I would generally encourage that. So let's take a few specific examples of certain areas. Common area for a joint injury would be an ankle sprain, and again, there's a big severity of difficulties from ankle sprains. But let's say we have a more severe type of ankle sprain, where, say, somebody has been out of action for, beyond 3 weeks, and we're working on rehabilitating them, getting them to progress through fast straight line running, hopping and jumping, twisting and turning, and then activities where they're distracted catching the ball or doing whatever chosen activity. And in those situations, it's not realistic to constantly focus on how you're positioning your ankle, whether you have control of it or not. And I generally recommend for those folks to use an elasticated support when they're transitioning back into sport. And sometimes that's just to give them confidence. Sometimes the extra little bit of pressure of an elasticated support, it stimulates the musculature. It helps what we call proprioception or body awareness, and that can just be enough to make an area feel more stable. So that's a common situation where we'd recommend that. And sometimes people just gradually wean themselves off it. Some folks just like the security of it, and it's really there's no one precise answer. Now, if you have a more severe ankle sprain, and we'll stick with this region for a minute, if the sprain and the ligamentous damage is more severe, so that there's a more mobility and unwanted motion in the joint, then sometimes an elasticated support doesn't give you enough mechanical bracing, and you have to escalate to a more structured kind of a support, which is in the ankle is usually either a lace-up brace or a brace that has extra reinforcement Velcro strips, and even some of the braces have little metal strips down the side to prevent distortions or more extreme ankle positions. Now, they are obviously much more rigid kind of devices, and whilst they have the advantage of giving an extra level of protection, they have the disadvantage in that they're a little bit uncomfortable for people to wear. But sometimes it's the lesser of two evils. People can put up with the discomfort of the pressure from the device simply because it allows them to do their chosen activity. The similar scenario would apply to the knee. Very often an elasticated support is sufficient to make it feel stable, but at people at the more severe end of the scale, maybe somebody who's had a cruciate repair that has been maybe not as effective in recovery as the typical time course, a normal anterior cruciate repair, one expects to get back to full contact in 6 to 9 months of activity, but sometimes they don't respond that way, and those folks sometimes get benefit from an elasticated support. Some will use a more rigid hinge support, at least to allow them to train, but those kind of devices usually aren't allowed in contact sports. So that can be a bit of an issue, but at least it can take the risk element out in a training environment. And heavy strapping could be used in a game situation where there might be some backup there to help folks prepare. Moving up the chain there, then of course the lumbar support will be a well-known one, and again, lumbar supports where people either have an unstable spine or a degenerate spine, if that allows them to do more, in my view, that's a good thing. That doesn't mean one doesn't try to enhance the muscle function by rehabilitating those areas, but sometimes there's just a practical limit to what can be achieved. So I think that can be appropriate in certain circumstances, particularly people whose jobs are high risk, where they have a lot of lifting, a lot of bending and carrying, and those type of activities. In fact, some companies, typically baggage handlers, couriers, deliveries, these kind of occupations, sometimes it's company policy to wear a lumbar support. Moving up to the upper limb, then probably the commonest upper limb supports one would see would be for a tennis elbow, and that's a device called an epicondylar clasp, which is basically a band type structure, which is used to try and alleviate pressure on the tendon in a chronic tennis elbow. And then some folks, when the tendon has just become persistently sensitive, the epicondylar clasp is a way of allowing them to do more, whether that's playing golf or doing gardening or activities that involve lots of gripping and manipulation without provocation, or certainly with less provocation. So that's a good situation. There are a couple of definite ones where bracing isn't recommended, and over the years we've seen a lot of patients with repetitive strain injury or occupational overuse injury in the upper limbs from keyboard use, from programming, legal secretaries, these kind of occupations. And the most intractable cases that I've seen over the years are folks who have used a wrist splint to ease pain in the wrists or hands and forearms, and initially got some improvement in symptoms, but then usually 3, 4, 5 months down the track, their symptoms deteriorated rapidly, and unfortunately those patients were ones that tended to be in the more intractable pain category. So for me, that's always a red flag. If somebody has a repetitive strain injury and they're contemplating using wrist splints, I'll just simply have to relay my experience over 30 years that the folks who have done that, although they may have got some temporary initial ease, have become often very intractable. So that's one exception to the rule, I would say. The other, which is certainly more prevalent now, is people who've had whiplashes or some sort of cervical trauma, soft tissue trauma. They used to be routinely issued with soft collars in casualty and sent on their way, and that now is generally not frowned upon. So in fact, the pendulum has almost swung too far the other way, and that it's quite hard to get people to use a soft collar now. And I definitely think there are situations where they can be used. People with nerve root problems with radiation down the arm often will get some temporary ease with a soft collar, or people, generally older folks with advanced cervical spondylosis with a head forward position and fixed curvature in the upper part of the neck, will often benefit and get some symptomatic relief from a soft collar. But because from a whiplash perspective, soft collars were abused and misused and instigated as part of spurious legal claims, they've attracted bad attention, certainly in this jurisdiction. So they are less commonly used, but I do think there is a role for them. So that gives you sort of a general overview of the issue of bracing and I suppose a clinician's perspective on what's good and what's bad about them. The general principle would be not to have to use them if you could, but if you do need them, and they're used to enhance your capacity, then in general that's a good thing to do, if it's albeit maybe a necessary evil. So I hope you found that background information helpful. I'll see you again on another video. Bye for now.